Hello, Mr. Harris. My name is Tenitra Brown. I'll be doing an assessment and an examination on you today, okay? What brings you into our clinic?
I need to establish care because I just moved to the city.
Okay. All right, so the first thing that we'll need to do is your abdominal assessment as well as your musculoskeletal assessment today. Is that okay with you? All right. So I'm just going to use a little sanitizer here and clean my hands. If you lift your shirt up for me, Mr. Harris, all the way up for me. So what I'm doing now, Mr. Harris, I'm just looking at the contour of your abdomen. I'm looking at symmetry to make sure it's even on both sides. I'm looking for any scars, any old scar or surgical wounds, any actual wounds, like I said, nodules. I'm looking for any abdominal distension, okay? And I'm looking for movement. So the up and down movement, that's going to be a normal movement just from you breathing, and also looking for any kind of pulsations from your aortic artery. And a lot of times you can see that, and I actually can see yours moving. And you also want to look to see if you see any peristalsis, which is abnormal, an abnormal finding, but you would want to take note of it, okay? Because that's the movement of your colon, okay? And I don't see that with you. Next thing I would like to do is auscultate your bowel sounds, okay? So we're gonna start over here with your right upper quadrant with the diaphragm of the stethoscope. All right, sounds like you got some normal bowel sounds. Then I'm gonna listen to those same landmarks with the bell of the stethoscope. So I wanna hear the vascular aspect of the abdomen. Listen for any roots, any rubs. Right here, I'm just gonna lift your shirt just a little bit below the xiphoid process. You'll find the aortic artery. Right here below the umbilicus, you'll find the iliac artery. I'm listening here with the bell. And then we'll also listen with the diaphragm. Then here we're gonna listen with the bell to the femoral artery. Listen for that swishing sound. All right. Good job, Mr. Harris. All right, so the next thing we're gonna do, I'm gonna palpate your abdomen. You let me know if you have any tenderness with me doing this. I'm feeling for any nodules, any tumors. I'm gonna go just a little bit deeper to see if I can feel anything. Any pain with me doing this?
No.
All right, so the next thing we want to do is percuss. I'm just going to tap on your abdomen a little bit. That dull sound, or a tympanic actually, sound that you're hearing is normal. Sounds just like a drum. Okay, next thing I want to do, Mr. Harris, I'm going to measure your liver. I'm just going to lift your shirt up just a tad bit here. And we're gonna measure your liver. Go till we hear a dull sound to that sound chain. Maybe right in here. Okay, we'll go down. You're right there. So maybe right in here. So about four centimeters, and that's normal. 4 to 5 centimeters is normal for liver size. Okay. Next thing I'm gonna need for you to do is take a deep breath in for me.
Okay.
Go right here underneath the rib cage. Try to find your liver. Palpate that. You can breathe out now. I was able to find that. We're gonna do it again because right there next to it is your gallbladder. Do that one more time. Breathe in. Okay, good deal. Yeah. Bring it down. Okay. Then we're gonna go over here to where the spleen. Take a deep breath in. Try to feel for the spleen. Normally you wouldn't be able to feel for the spleen. Okay, come on down. You can breathe out. But I'm gonna see if I can hear any dullness with the spleen. That sound changed like right in there. Okay. All right, because if you're able to feel the spleen, then that means that you got some enlargement, and actually I wasn't able to feel it, okay? All right, so that's everything with that. If I can get you to sit up for me. now I'm gonna feel your temporomandibular joint here. If I can get you to open your mouth for me. And protrude your jaw out. In, to the left, to the right, your jaw, just your jaw. Now there you go, do that again. We feeling for any crepitus, any clicking, anything like that. I'm not feeling anything. Do you have any pain with me doing that? If you take your chin to your chest for me, back up. All right, I want to take one ear to your right side, then to the left side. Okay, hyperextend your neck back a little bit. Good. Any pain with doing any of that? Okay, while I got you sitting here, I'm just gonna look at your shoulder girdle here. And I'm looking for symmetry, contour. I'm pressing here to see if you have any soreness in these areas. Then I'm gonna go right here where your supraventricular notch and go all the way down with my fingers following the clavicle, all the way down to the acromion process. Right here, a little skinny bone right here. All right, then we'll go right down here to the pectus, the ductus pectoral process, and find the cricoid process over here to the side. Then we'll find your medial epicondyle and your medial tuberal and your lateral or your greater lateral tuberal, okay? And also your lateral epicondylus right in here. Since I have your arm out, we'll go ahead and find our radial head, which will be, let's see if we can locate that. Right in here, that's your radial head. If you lift your arm up, right here, this little bone right here at the end is the cranial process. Okay, kind of like your funny bone. All right, then that arm out, we'll come right on down and we'll find the ulnar head, which will be right here. It's very prominent. And right in here is the ulnar or the extensor ulnar, right in this area, right below the pinky finger. Okay. So now I want you to flex that arm up for me. Good. Now flex it back down. I'm going to let you flex it up one more time, and this time I'm going to pull against it. Good. Good job. Now see that you have a fist. That's good. Nice, strong fist. All right. Now I'll get you to stand up for me and turn around. Put that chin into your chest, and I'm going to examine your cervical spine here. We're going to go down each one of these vertebrae just to check and see if there's any bulging, if there's any distension, if it's symmetrical and in alignment, and it is. Down to C7, which is the bone that is more prominent, protrudes right here, okay? Then after that, we're going to let up your shirt. You bend down and touch your toes. Okay, so what we're going to do here is just look at the curvature of your spine. Your spine goes into an S shape, go from a concave to a convex to back into a concave, and that's normal here. All right, so we're going to go down each one of these vertebrae, looking for any bulging, looking for any nodules, feeling to see if you have any pain or any distension. Any pain or distension, Mr. Harris? No. Okay, we're going to feel those paravertebral muscles, and we're going to check for any instability, any crepitus, any tenderness in those areas. You had any tenderness?
No.
All right, right in here, if you stand up straight for me, we're going to go ahead and check your kidneys, for your kidneys. Right in here, we'll palpate those kidneys. Any pain while I'm palpating these kidneys, Mr. Harris?
No.
All right, just over just a tad bit, and I'm gonna percuss a little bit. I'm gonna hit it with my fist. Any pain when I do that?
No.
Okay, good. Now I wanna go ahead and I'm gonna check your hips here. And what I'm doing is checking for length discrepancy, also instability, tenderness or crepitus in the hip area. And I don't feel any of that. Any pain when I'm doing this?
No.
Okay. Good. Okay, Mr. Harris. So now, if you would, can you extend your leg back while you're in this position? All the way back as far as you can. You're a young man. You gotta be able to extend. Okay, good job. I want you to follow me. Come on back down. All right, turn around towards me. I want you to extend those arms out, back down, out, back down. gonna take that right arm and I want you to touch that left scapula. All right, bring it down and I want you to take that left arm and touch that right scapula. As far back as you can. Good job. Up and back down. Now I want you to shrug your shoulders for me. Good. Any pain with doing any of those exercises?
No.
Okay, so I want you to squeeze those scapulas together. Bring it back out. I want you to pull them apart. Good. Now I want you to take them down to the floor. All right. All right, any pain with doing any of that? Okay, Mr. Harris, you can sit back down now. Just sit down for me. Not legs, just sit. Okay. And if you will hold your hands out. Hold your hands out. Okay, so I want you to flex your fingers down. Okay, flex them back or extend them back out. I want you to abduct them. I want you to adduct them. Bring them back in. Good job. I want you to flex your wrist down. Now, the whole wrist. Flex it and extend it back out. Now, hyperextend it for me. Can you hyperextend? Very good. Back down. And now I'm just going to take a look at your hands here. Examine each digit. Anytime you examine in the hands, you have to be very careful with making sure that you examine each one of the joints because you have so many bones in the hands. And we're looking for any kind of deformity, any kind of lesion, nodule, any abnormality, any swelling, any tenderness, any inflammation, I've already said, any redness, any of that while I'm doing this to your hands. Okay, good job. Okay, and you do have 5 digits on each hand. Okay, now, so the next thing that we'll need to do, Mr. Harris, we're gonna go ahead and examine your hips. So if you would turn your legs around here. Straight out for me. I want you to lift that hip up, lift this leg up rather, all the way as far as you can, back down. I want you to bring it out. Good job. Back in. But when you bring it back in, I want you to cross it over. Cross that leg over. Good job. Now, right over here is your greater trochanter. Okay? Your greater trochanter. Then you have the sciatic notch right below that. And then right here underneath your butt bone is going to be your ischial tuberosity. Okay, so you got the ischial tuberosity, you got your sciatic notch, which houses the sciatic nerve, and then your greater trochanter here. So you have to be very careful when you examine back here. And it looks as though your gluteal folds are even and symmetrical. Okay? Okay, if you put your legs down, well actually you just keep this leg flexed. All right, and I'm going to try to pull against this leg. You don't let me. You're going to check your strength here. Good job. Okay, now I'm going to push it and you don't let me. All right, good job. Good. So now we're just going to look at your knee. We're just looking at your knee. You just relax. Just relax. All right, so here we have the condyle, your medial condyle and your lateral condyle, and they kind of house the patella. And the patella sits right here in the middle. And then you have your patella ridge. Right below the patella ridge, you have your tibial tuberosity. And of course, you have your tibia and your fibula and your leg. Okay? Right behind the leg, if you'll extend out for me, you have your popliteal. Okay? And this is where your fossa is located. A lot of times, people might get a little lump or something back here and then some soreness. Any soreness while I'm palpating this area? No. Okay, very good. Okay, so then we go all the way down the leg. I don't feel any kind of swelling in this area. I don't feel any obvious loose bones. No pain or anything while I'm palpating the legs. Okay. Okay, so now what I need for you to do, look at me, Mr. Harris. I'm going to need for you to press. Do just like this with your feet, just like you're pressing on glass. Okay, bring it back up. Okay, now I need you to do the same thing to my hands. Okay, good job. Now, I need for you to take your feet and spread them apart. Okay, good. Bring them back in. No. I just want you to bring your feet in together, just like that. Good job. Okay, now, next thing we're going to do, I'm just going to feel your feet and your Achilles tendon here, ankle bone. You You have a lot of bones as well in your feet, and you do have 5 toes on both feet. We're gonna rotate just a little bit. Any kind of pain while I'm doing that?
No.
No. All right. Good job. Okay. And we're gonna just examine each one of these toes and look into for any nodules or any inflammation, any redness in your toe area. And of course, I don't see any of that. No inflammation at all. Okay. So I think, Mr. Harris, we've touched each system that we need to. Do you have any questions for me? Okay, I think that we've done everything. Thank you so much for allowing me to do your examination, okay?